Hey, Jackie, how are you?
Good. How are you?
Good. Thanks so much for meeting with me today. So, just from my audience's perspective, Jackie Reed is a licensed social worker, and I asked her to meet with me today to kind of help us understand what are the differences between a social worker and a health coach, because I get that question asked of me all the time, Jackie. So, why would I meet you versus a social worker? So, I kind of wanted to do a meeting today to kind of discuss the differences, how you deal with your clients versus how I deal with my clients. So, let's just do a little brief description or summary of what a social worker does. And, you could add to my summary if you feel like I have to add something. So, a licensed clinical social worker basically assesses, diagnoses, and treats people with mental health disorders. Whereas a health coach is starting with a person that is relatively in good mental health, but they might need some help in their lifestyle changes, like if they're on a diet and they need help with, how do I eat right? How do I exercise? So that kind of summarizes the differences. So I don't know if you want to add anything else to that, but that's a very high level summary.
Right. I love that. I think, social workers, I guess we're more in the therapy world. We're diagnosing, assessing, and treating. That's kind of the three main points that we do. But you summed it up perfectly.
And also, obviously, a licensed clinical social worker has to go through extensive educational requirements and licensing requirements, right? So, and there's all different stages. There's social work, licensed social worker, licensed clinical social worker. And I know you're an LSW and you're going towards your clinical certification, hopefully, mid 2025. So that's, great to hear. And then full disclosure to the audience, you are my son's girlfriend, but I did not choose you for that. I chose you because your expertise in this area. So I'm really, happy to have you on board today. And let's dive in here and tell everyone what you do and how it could help them. So some of the core questions I want to ask you today are about stress management and the mind-body connection. So how does working with a social worker help clients to manage stress and its symptoms? And what are some of the approaches you would use in your practice?
So in therapy, what I like to do for clients to help them manage their stress is we first identify any stressors and triggers, and then we develop coping strategies to deal with those things that we identified. And also throughout therapy's entire time in session, we build resilience. And so some of the approaches that I like to use to implement those three steps are cognitive behavioral therapy, which is where the client learns how to reframe negative thoughts. Maybe they recognize different negative thought patterns that they have, and we essentially reframe that. And then another approach is mindfulness and relaxation techniques. And the last one that I really like is solutions-focused therapy, which is where clients identify strengths and they begin to focus on small steps and goals that help reduce stress.
Great. And then what about the mind-body connection? How does addressing mental health affect somebody's physical health?
Well, the mental and physical health, they're interconnected entirely. Things like chronic stress, anxiety, depression, they all actually can manifest physical symptoms such as headaches, digestive issues, high blood pressure, a weakened immune system. So addressing mental health in general leads to things like improved sleep, lowered risk of chronic illness, better coping mechanisms, and then also just an improved immune system as well.
Right. And I find that in my practice too, if people come to me with just, stresses from just, that work-life balance, I tell them all the time, stress can raise your cortisol levels, which affects your weight, right? What you put into your body, how you exercise. I encourage every people to, move every day. You are what you eat. So it really does affect, stress is, really affects, the physical if you don't take care of the root cause of the stress to begin with.
Exactly.
And in your practice, I have my own kind of tools that I would use with people, but what are some of the key strategies that a social worker would provide to your clients to manage, anxiety and depression? And then more importantly, how do people use those tools after they leave you, when they're on their own?
Mhm. So most, if not all of the techniques and tools that I like to teach in session are things that my clients can use wherever they are, whether they're out with friends, they're at home, they're awoken during their sleep, right? So they're laying in bed, maybe they're driving. So all of these tools, I like for them to be easy and convenient and actually work. These techniques are things like grounding techniques that help us during moments of panic, bring us back to present time, where we're not worrying about what's happening tomorrow, we're worrying about right now. And so grounding techniques help with that. Another tool that I like to teach my clients is journaling, right? So writing down thoughts and emotions to help them process difficult feelings and recognize patterns in their emotions. Cognitive reframing, I touched on that a little bit earlier when I mentioned cognitive behavioral therapy, but cognitive reframing is also another huge tool that I like to teach. Self-care routines, and then also behavioral activation. So this is where I like to encourage my clients to engage in meaningful activities, especially when they don't feel like doing it, because when you do something when you don't really feel like doing it, it helps build this momentum towards recovery. So imagine when we wake up and we have this gym routine and I don't want to go, I'm tired, but we actually force ourselves to go. We get that movement in. That helps us build a habit and creates this consistency in our life that's necessary. So I love these strategies because they empower clients by giving them practical daily tools to regain a sense of control over their emotions and well-being.
Right. I agree 100%. And then, I want to touch on something, in particular, a trauma patient is someone that I probably would not deal with, right? So that's something that a social worker would be more helpful in. So, how does addressing trauma in somebody's life, influence their overall well-being? And do you have any examples you can share with the audience on, you don't have to mention clients by name, obviously, but how you've helped somebody with, a particular trauma in their life?
Yeah, a lot of people may not know this, but people that have experienced trauma in the past might have not actually healed from that trauma. And so this trauma may actually be affecting their present life in ways that you wouldn't even think, right? Maybe we're anxious, or we're not sleeping well, or we are in this constant fight or flight mode. That can all be from past traumas that we didn't heal from yet. And so trauma-informed therapy includes doing things like reducing symptoms of PTSD, anxiety, depression, obviously, and then also improving emotional regulation and interpersonal relationships, and then also helping them restore a sense of safety and empowerment. So an example that I can give is, let's say a client who experienced childhood neglect. You might see them struggle with things like trust in relationships, and unhealthy relationships overall. So through therapy, they'll learn how to identify triggers, develop healthy boundaries, practice self-compassion. And so over time, they'll begin to experience improved self-esteem and healthier relationships.
And you brought up something, unaddressed trauma in someone's life. They might not even realize they have it, right? And that's important for me as a health coach to see when I'm meeting with a client, because I can have a client that I'm meeting with, and all of a sudden after a few sessions, we both realize, hey, this stress is caused by an early childhood trauma you've had, right? And at that point, I would say to the person, hey, I don't think it's going to be, beneficial for you to continue meeting with me. I would recommend her to, a licensed social worker to help. So I think that's really important for people to see too. And they might not know it initially, but, going through the sessions with a health coach can kind of bring that out. And then they maybe would need to seek help from a social worker. So that's something I would not do. I would have to stop the appointments and recommend them to somebody like yourself. So that's, really key that you mentioned that. Let's get into a little bit of, barriers to people seeking out help. So, what would you say, today versus 20 years ago? Like, how many clients do you have that are young, middle-aged, old? And, what is the mentality of each one of them as far as they're comfortable meeting with a social worker? And for those that are not comfortable, what are those barriers and how would you help address them?
Yeah, so first off, I guess I see more younger clients coming to therapy and being most willing to accept the challenges that they're facing and actually address them. With that being said, I think two of the biggest barriers to help would be stigma and financial constraints. So stigma, a lot of people fear being judged for seeking things like mental health support. And then when it comes to financial constraints, therapy can be very costly. But a lot of the times practices offer things like sliding scale options and community resources to help pay for therapy. And then also, obviously, a lot of practices also accepting insurance, which cut down the cost of therapy tremendously. Not all practices accept, but some do. But this idea of stigma, I don't know. I'm definitely in the younger generation, and throughout, let's say, high school, mental health was never really spoken about. I just now in my career see a rise in school social workers being added so that mental health can be addressed at a young age. But that was within only the last few years, maybe since COVID 2020, that I start to see that being implemented. So slowly, the stigma is being broken down. So I hope it continues to move in that direction because of all of the reasons that we mentioned earlier, right? How mental health can affect our physical health as well. So, but yeah, that's my hopes, is that some of these barriers are brought to light so that we recognize, wow, getting help maybe isn't that difficult. It's only ourselves telling us that there's these barriers.
And I think also, it's not like 20 years ago where, therapists had an office physically located somewhere with a big sign outside and people see you walking in and out. Now you can actually get help via video, right? You do it from your own home. It's much more easier access. And it's, to me, definitely more private for people.
Right. Yeah. My advice is that seeking help is a sign of strength. It's not a weakness at all. And if you're ever hesitant, start by having an informal conversation with a professional or exploring these online resources. Actually, a lot of practices have 15-minute consultation calls where you can express any concerns you may have regarding therapy, ask the questions you need. And so I wouldn't see why not have this free 15-minute phone consultation you can decide after that what route you would like to take, yes to therapy or no. But I do just want to say, if anyone's ever having a mental health emergency, I live in the state of New Jersey, and there are different hotline numbers that you can contact if you're feeling suicidal. The one that sticks out to me the most is the NJ Hope line. That number is 855-654-6735. And I'll also provide you, Daria, the link to additional hotlines in New Jersey so that maybe you can add it somewhere under this interview, just in case somebody feels like they're in a crisis. Obviously, 911 is a very reliant number, but these hotlines are nice too, to talk with a mental health trained individual rather than like an emergency number.
So you practice out of New Jersey right now. So what is your specialty? And if somebody was not in New Jersey at the moment, how would you recommend them seeking out, a therapist?
Yeah, right now I practice, my license is in New Jersey. I do plan on possibly expanding my licensure to New York, PA. I just have to see kind of where my career takes me. So I can only see individuals that are currently in the state of New Jersey at the time of our session.
Mhm.
Sounds a little silly. That's just how licensure works. But yeah, virtual is a way. It's very convenient. Now, if somebody comes to me and they're not in the state of New Jersey, I would recommend a colleague that I know that possibly is licensed in the state that they're at.
Okay.
Or I would help them do a search as well to find somebody who can begin treatment with them.
Okay. And I think that's important because you want to go to reputable sites to try to seek out, a properly licensed and trained, social worker to, make sure they've been vetted and, not just choose anybody.
Right.
Great. Well, Jackie, I want to thank you so much today. You've given our viewers so much information, and I do appreciate it. Is there anything you want to add, or, how would people, get in contact with you?
Okay. Well, firstly, Daria, thank you so much for taking the time to speak with me today. It was a pleasure. And I just want to add that having good mental health is vital to creating a balanced and healthy life. So seeking support is a very courageous step towards healing and growth. And if you'd like to learn more or connect with me, you can reach me at my business number, which is 732-795-2912, or you can shoot me an email at jacqueline.reed@resiliencelab.us. And then also, I have a professional Instagram account where I like to post tips and inspirational content. That account name is Therapy with Jacqueline, and you can also message me on Instagram as well.
Great. Well, thank you so much again. I really appreciate it. And, have a great rest of your day.
Thank you so much. Bye.
Bye.